Diabetes mellitus in dogs and cats. Diabetes mellitus is when there's a deficiency or decreased action of insulin, which leads to hyperglycemia. There are two types. Type 1 is insulin dependent and type 2 is non-insulin dependent. Type 1 is when there's an autoimmune destruction of beta cells and it's common in dogs. Type 2 is when there's insulin resistance and it's common in cats. It's an obesity problem. Pathogenesis. In type 1, there is an immune-mediated beta cell destruction or pancreatic damage. And in type 2, insulin resistance increases glucose toxicity, which causes beta cell destruction, and then it can also lead to type 1 diabetes. The clinical signs. In dogs, there's uncomplicated diabetes mellitus and complicated diabetes mellitus. In uncomplicated diabetes mellitus, we can see polyuria, polydipsia, weight loss, cataracts, and hepatomegaly. Complicated diabetes mellitus consists of ketoacidosis, hyperglycemic hyperosmolar syndrome, and pancreatitis or EPI. Ketoacidosis, we can see in acetone breath and cosmol breathing and lethargy. Hyperglycemic hyperosmolar syndrome, we can see neurological signs. And in pancreatitis or EPI, we can see vomiting and abdominal pain and foul feces. In cats, we can see polyuria and polydipsia and a plantigrade posture due to the neuropathy, weight loss, and hepatic lipidosis. Laboratory findings, we can see hyperglycemia, so the glucose is above 12 millimoles per liter, glucoseuria, and an increase of ALT. And we can also see ketonuria if there's ketoacidosis. In cats, use fructosamine to differentiate between hyperglycemia from stress or hyperglycemia from diabetes. For diagnosis, check the glucose levels after fasting, the urine analysis for glucoseuria and ketonuria. Check fructosamine in the case of stress-induced hyperglycemia in the case of cats. For the treatment, you can use insulin therapy. For dogs, use CAN insulin for dogs and cats. Hopefully bring the post-insulin glucose down to 4 to 9 millimoles per liter. If hypoglycemia occurs from the insulin, put honey on the gums, give food, and skip the next insulin dose. In the case of ketoacidosis, give fluids, so give ringers with potassium chloride, give insulin regularly, and bicarbonate for the acidosis. The diet of a diabetes patient should have high protein, high fiber, and complex carbs. Have consistent feeding schedules before insulin administration. Patients with type 2 diabetes, manage their diet and make sure they exercise and lose weight. Oral agents such as glipizide can also be given. For monitoring, they should be monitored initially 2 weeks after the first treatment and then long-term every 3 to 6 months. For the complications, hypoglycemia can occur from giving insulin and it can cause tremors, seizures, and weakness. The Somogyi effect is rebound hyperglycemia from excess insulin, and other diseases can cause insulin resistance, such as Cushing's. Stress hyperglycemia is common in cats.